A hospitalist is a doctor who goes into internal medicine training, but instead of going into a clinic to see patients in an outpatient setting, she practices medicine in a hospital setting, taking care of patients that are hospitalized. She admits the patients to the hospital, takes care of them while they're here, and then discharges them back to their primary care doctors. We focus our continuing medical education on heart attacks and strokes and the most effective way of treating GI bleeds and acute kidney failure. And we're so efficient from the minute that we get the patient in from the emergency room, every bit of their hospitalized care is streamlined to get them well as fast as possible, get them discharged as quickly as possible, and onto the next phase of their recovery as efficiently as possible. The way that our job works as hospitalists is we work 7 days on and 7 days off. We work 24-hour days. We provide emergency room coverage, and we round on the patients here in the hospital. And this week, they are seeing about 12 to 17 patients a day. Patients that we see are either the patients that we have admitted from the emergency room, people with like pneumonia or a GI bleed or a stroke. For 12 years, we've been trained under the guidance of 5 board-certified pulmonologists and at least 6 physicians that are specialists in critical care. They're called intensivists down at Gainesville. And we've been training shoulder to shoulder with them, and we can implement their tried and true standard of care from that hospital where there's a multitude of specialists. We have that information and all the medications they use and their styles of practice in medicine, and we can implement that right here in Chestatee. It's a cutting edge way of patient care. It's the most efficient, most beneficial, technically savvy way to take care of a patient. And in my opinion, when that Dahlonega has brought us in here shows that the physicians of Dahlonega and the CEO of Dahlonega's hospital are at the forefront of their mind is that they're doing everything they can to take the best care of their patient. They're trying to bring the latest and greatest cutting edge technology that other larger hospitals have used for 10 years, and they're insisting on it being brought here to take care of their patients. They realize they're getting the same inpatient specialists and they don't have to drive all the way to Gainesville to get that care. The same doctors that would have been taking care of them in Gainesville are now here in their own backyard in Dahlonega, and the patients love that. I've had patients offer to write newspaper articles just to commend us on the type of care and quality of care that they've received here at Dahlonega.